Do you really know how many calls your practice missed yesterday? Not a rough guess, the actual number. My name is Anmol and I'm the co-founder and CEO of Emitrr. We work with over 1,000 healthcare practices, and one thing I can tell you for certain is that most practices have no idea what that number is. And the reason that matters so much is that every one of those missed calls is a patient who needed something, and in most cases didn't wait around. Now I want to be clear about something up front. I am not here to say healthcare front desks are doing a bad job. They're not. If anything, the practices we work with have front desk teams that are working incredibly hard. But the system those teams are working inside is letting patients fall through the cracks every single day. And most practice owners don't see it because there's no report for a call that was never answered. There's no alert for a patient who quietly called another clinic instead. It just happens and nobody notices until the schedule starts looking thin. Let me explain what I mean with a scenario, because I think this is easier to understand when you can picture it. Think about a typical Monday morning at a busy practice. The weekend just ended. Patients who called Friday at 5 p.m. are still waiting to hear back. New calls are coming in. The front desk has 2 or 3 people, and they're already checking in the first wave of patients who walked in the door. So the phone rings, nobody gets to it. It goes to voicemail. Now here's the thing. 85% of patients who hang up and hit voicemail do not call back. They call another practice. Think about that for a second. Not most of them. Not half of them. 85%. And this is not just happening on Monday mornings, right? It happens at lunch when coverage drops. It happens after 5 p.m. when the office closes but patients are very much awake and trying to book. It happens anytime there's a walk-in and the phone rings at the same moment. And then there's the voicemail problem, which honestly deserves its own conversation. Let me ask you a simple question. Do you actually believe your front desk team comes in every morning and listens to every single voicemail sitting in that queue? Let's be honest. In most cases, they're not. And I don't say that to be critical. I say that because I've seen it firsthand across hundreds of practices. Your team comes into a Monday with 40 voicemails, patients already standing at the window, and a full schedule that started 10 minutes ago. The voicemails sit there. And here's the real problem with how voicemail systems are designed today. They are essentially a dump of sticky notes. There's no way to know which one is a new patient trying to book for the first time, which one is someone asking for your office hours, and which one is actually urgent. They all look the same. So the front desk does what any reasonable person would do under that kind of pressure. They get to them when they can, which on most days means they don't. Now, just last month, we were onboarding a practice about 10 offices using eClinicalWorks. And right in the middle of the training session, one of their team members said, "Hey, we actually can't do this right now. We need to call our patients." And I asked why, and they said there was a plumbing issue in one of the offices. So they had to manually call every patient scheduled for that day to reschedule. Think about what that means. The entire front desk occupied for hours dialing patients one by one to tell them about a plumbing problem. That's not clinical work. That's not even real admin work. That's just the system not having a way to close the loop automatically when something unexpected happens. And this is the pattern we see everywhere. It's not laziness. It's just that nobody built the right infrastructure to catch what falls through. Now, what does the actual cost of this look like? I'm not going to throw a bunch of numbers at you, but I will say this. A new patient who couldn't reach you and booked somewhere else, that's not one appointment lost. That's that patient's entire relationship with a provider. Every follow-up visit they would have come back for, every referral, all of that gone, and you never even knew they called. So what does fixing this actually look like? Because most practice owners hear this and immediately think, okay, we need to hire someone. And sometimes that's true. But in a lot of cases, the gaps I'm describing don't need more people. They need the system to stop dropping things. Let me give you a concrete example. When a patient calls and nobody picks up, instead of that going to voicemail and sitting there for 2 days, the patient immediately gets a text right then. Something simple like, "Hey, we saw you called, we'll get back to you shortly," or "Text us here and we can help." That one thing alone changes the whole experience. The patient knows they were noticed, they stay in the loop, and your team gets a text message to respond to when they have a moment, instead of a voicemail to dig through. For after-hours calls, the same idea applies. Instead of hitting a recording and hanging up, the patient reaches an AI that can actually have a conversation with them, collect the reason for the call, book the appointment if that's what they need. And when your team walks in the next morning, everything that came in overnight is already logged, categorized, and ready to act on. No tricky voicemails, no patients wondering whether anyone got their message. And we actually talk about this internally as the goal of 0 voicemails. You know how some people say their goal is 0 unread emails? For a healthcare practice, the equivalent should be 0 voicemails. Because a voicemail sitting in a queue is not a resolved patient request. It's a request that's waiting to be lost. The other piece of this that I think gets underestimated is no-shows. Right now at most practices, when a patient misses their appointment, someone on the front desk has to track them down by phone. Another outbound call, another voicemail left, another loop that may or may not close. What should happen is that the moment a no-show is recorded in your EMR, an automated message goes out and invites them to rebook. The slot gets a real shot at recovery without anyone lifting a finger. This is what we built at Emitrr, the missed call to text. The AI after-hours agent that actually books appointments, not just takes messages. The smart inbox that routes prescription refills to the pharmacy team, schedules requests to the front desk, and keeps everything from piling up in one undifferentiated queue. When all of these pieces are in place, the front desk comes into a completely different morning. Here's what came in overnight. Here's what the AI already handled. Here's what still needs a human today. That's a very different experience than wading through 40 voicemails hoping nothing urgent slipped past. If you run a practice, I'd encourage you to just ask yourself one question after watching this. How many calls did your office miss yesterday? If you don't know that number, that's where to start. If you want to see how Emitrr handles this end-to-end, the link is below. And if you found this useful, subscribe to the channel. I keep making these videos because honestly, most of these problems are completely fixable. They just need the right setup.